Hi everyone, I'm Dr. Sahitya Yenugula, consultant and fertility specialist in Genesis Fertility and Laparoscopy Center. I have with me Mr. Lakshmi Narasimha sir, our chief embryologist in Genesis. Today we are going to discuss everything about sperm DFI. Is it so, sir?
Yes.
So you had few questions. I think I'm ready to answer now.
So first let us know what is sperm DFI.
So the sperm has a head, a neck and a tail. So this head contains a nucleus in which it has a genetic material in the form of DNA.
Okay.
So DFI is DNA fragmentation index, where we measure the damage to the DNA which is fragmented.
When do you advise DFI?
So this is the most frequently asked question, whether we have to get the DFI done or not. Men who are aged above 40 years and men who are obese and men who has history of excessive alcohol consumption and men who has history of smoking and couple who take very prolonged time for infertility, or they have history of prolonged infertility and they have any history of previous failed IVF cycles, we do definitely advise DFI. And one more thing, if the men are diabetic. When is the right time to get the DFI test done? Second one is, how do you do DFI test? And third is, how do you read the results of DFI test?
So before coming to the test, men should have at least 2 days of abstinence. So that will give you the good result. So usually we collect sample from the men. We'll go to the lab and I'll show you the entire process.
Sure, definitely.
Patient semen collection చేసిన తర్వాత శాంపుల్ అనేది ఆండ్రాలజీ ల్యాబ్ లోకి తీసుకురావడం జరుగుతుంది. సో శాంపుల్ లిక్విఫాక్షన్ అయిన తర్వాత ఎవ్రీ స్టెప్ లో డిఫరెంట్ కెమికల్స్ యూజ్ చేసి మనం స్టెయినింగ్ చేస్తాం. కెమికల్స్ యూజ్ చేయడం వల్ల ఏమవుతుందంటే స్పర్మ్ అనేది కెమికల్స్ ని రిసీవ్ చేసుకొని హాలోస్ ని ఫామ్ చేయడం జరుగుతుంది. సో ఆ హాలోస్ ని ఫామ్ చేసిన దాన్ని బట్టి ఫామ్ లో డిఎన్ఏ ఎంత వరకు డ్యామేజ్ అయ్యిందని చెప్పేసి మనం అనలైజ్ చేయవచ్చు.
హలో అంటే
సో హాలో అంటే ఏంటంటే స్పర్మ్ హెడ్ ఉంటుంది కదా, హెడ్ పక్కన మొత్తం ఒక సన్ బస్ట్ లాగా వస్తుంది అనమాట. సో అది మీకు ఇమేజ్ లెస్ చూపిస్తాను. సో ఇవన్నీ స్పర్మ్ హెడ్ అనమాట. పక్కన కనిపించే పింక్ కలర్ మొత్తం ఏమంటారంటే హాలో అంటారు. సో ఈ డిఎన్ఏ ఇంటాక్ట్ ఉండి హెల్తీగా ఉన్న స్పర్మ్స్ లో ఏంటంటే హాలో అనేది పెద్దగా కనిపిస్తుంది. హాలో అనేది మీడియం గా ఉందనుకోండి, అది దాంట్లో డిఎన్ఏ ఫ్రాగ్మెంటేషన్ అనేది మోడరేట్ గా ఉంది అని అనమాట. హాలో అనేది ఫామ్ అవ్వలేదు. దట్ మీన్స్ డిఎన్ఏ ఫ్రాగ్మెంటేషన్ అనేది ఎక్కువ ఉంది ఆ స్పర్మ్ లో. సమ్ సెల్స్ లో ఎలా ఉంటుందంటే ఇప్పుడు ఇలా ఉంది, అసలు హాలో ఫామ్ అవ్వలేదు. దట్ మీన్స్ స్పర్మ్ లో ఉన్న డిఎన్ఏ అనేది కంప్లీట్ గా డ్యామేజ్ అయ్యి ఉంది. ఇప్పుడు ఏం చేస్తామంటే ఈ లార్జ్ హ్యాలోస్ ని, మీడియం హ్యాలోస్ ని, స్మాల్ హ్యాలోస్ ని, నో హ్యాలోస్ ని క్యాల్కులేట్ చేస్తాం. సో ఈ క్యాల్కులేషన్ వల్ల ఏమవుతుందంటే మనకి పర్సంటేజ్ తీసుకున్న తర్వాత డిఎఫ్ఐ రేంజ్ ఎంత ఉందని చెప్పేసి మనకు తెలుస్తుంది. రేంజ్ అనేది లెస్ దెన్ 15% ఉందనుకోండి, దట్ ఈస్ నార్మల్. 15 to 30% ఉందంటే అది మోడరేట్. మోర్ దెన్ 30% ఉందనుకోండి, అది అబ్నార్మల్ కింద కన్సిడర్ చేయడం జరుగుతుంది. What are the main causes for the raised DFI?
So medical causes for raised DFI are diabetes and any infection, inflammatory disorders, or any testicular issues, like if there is any defect to sperm production or any varicocele. And genetic causes are like gene defects and impaired sperm mutations.
What happens if sperm DFI raised?
There will be prolonged time to get conceived and failure to conceive, increased risk of miscarriages and pregnancy loss. There will be poor outcome if do any fertility treatment like IUI, and impaired fertilization and embryo formation even in IVF cycles, in turn will leading to decrease the success rate of IVF as well.
So how can we reduce the sperm DNA damage?
So there are 3 ways to reduce the sperm DNA damage. So one is lifestyle changes, second one is dietary advice, and third one is medication.
So when you recommend TISA when DNA damage is raised?
If the DFI is more than 25, we would recommend TISA.
Okay.
Because in order to avoid the DNA damage which happens from the site of production, that is testis, which all the way travels through the genital tract, where there's a lot of exposure to the toxins and probability of more damage to the DNA. Rather, it's like more of like we are picking it from directly from the factory, that is testis. So in that cases, we recommend TISA.
What are the best foods you recommend to reduce the DNA damage?
Ideally, vitamin C and vitamin E rich foods, as well as antioxidant rich food. If you ask me what are all those foods, foods like fruits, vegetables, nuts, seeds, and healthy fats like salmon, avocado. All these, I think they will give lots of vitamin C and E, even for general health as well.
What are the lifestyle changes you recommend for the reduce the DNA damage?
Lifestyle changes is like moderate exercise every day and eating healthy diet, quitting alcohol, quitting smoking, and reducing weight if you're overweight or obese. All these are lifestyle advice which we can recommend for reducing DFI.
Can you explain what are the medications to treat the best for the DFI?
So medication which we would advise to reduce the rise to DFI are antioxidants like coenzyme Q and vitamin C, vitamin E, and L-carnitine. And if there are any infections, we would definitely recommend antibiotics. If there are any inflammatory disorders, we recommend anti-inflammatory drugs, depending on the situation.
So how to manage high DFI semen samples during fertility treatments?
Okay, you are asking me whether all these lifestyle changes
Yes.
and medication are not working, and if we want to go ahead with IVF and we want to have reduced DFI and good quality sperms.
Yes.
So we do have sperm separation techniques like microfluidics, MAG, MC, PIXI, and TISA. So we can do all this, any one of the procedures based upon the patient scenario.
What is MAX?
So MAX is magnetic activated cell sorting, where we tend to separate sperm cells by using magnetic beads and antibodies.
Okay.
So thus we collect good quality sperms.
So what is microfluidics?
Microfluidics is a procedure where we allow the semen sample to pass through some physiological kind of filters, where we do get low DFI sperms, and we select that kind of sperms, and we use that selected sperms and good sperms for the IVF.
Okay. So what is TISA?
So TISA is a very daycare procedure and very small procedure which is done under anesthesia. So here we use a tiny needle to collect the sperms from the testis, and we do check those sperms under the microscope.
So what do you do with the TISA sperms?
The collected sperms we see for the normal forms, morphology, and the number of sperms in a high power field, and we select the good sperms, and we do use them for IVF, and the excessive sperms are frozen.
So can we use the TISA sperms for IUI?
No, can't use TISA sperm for IUI because it doesn't have penetrative capacity. So we can use TISA sperm only for IVF.